Welcome to the show, the Healing Docs Show, brought to you by Absolute Healthcare, LLC, Medical Chiropractic Care, 3 locations to serve you, Spring Hill, Port Richey, and Tampa, heard every Sunday at this time on this station. We got the Healing Docs in the studio once again from Absolute Health, and we've been talking about a lot of important information dealing with your health. That's what it's all about, making sure that you are healthy. And of course, the docs are here to share some more information, important information about overall sexual health. You don't have to be embarrassed to ask the questions. They're going to cover those questions live on the air as we speak during this show. Of course, it is pre-recorded, but we do appreciate all the input we are hearing from all of our listeners out there every Sunday at this time. It is the Healing Doc Show's Absolute Healthcare. And in the studios, once again, we've got Dr. Malhotra and, of course, Dr. Gupta. Dr. Malhotra, also known as Dr. G, and Dr. Gupta. Welcome once again, doctors, to the studio.
Thanks for having us.
You are the Healing Docs, and you have most of the answers, if not all the answers, being doctors in the local area for a number of years. And we do appreciate all your input and all the information you bring to the table. It is very, very educating and sometimes entertaining. But when we talk about sexual health, it could be both entertaining and educating as well. So
it is quite entertaining.
Let's get down to brass tacks.
So Dr. Gupta and I were discussing about, I think men do bring up the topic much more commonly than women, but women somehow do not bring it up to their physicians that they're having this issue, and that can cause some problems with their relationships because the male sexual drive is definitely higher with all the testosterone we have, and the female sexual drive is not as strong. So sometimes they might shy away with one reason or another, thinking it's something that's beyond their control and cannot be fixed. But I think it's very important that they understand that it is a topic that they should bring up with their physician, because we are here with a lot of solutions for problems. And if you do not cover that aspect of health, a major part of your life and the pleasures of life can be missing. We in our office don't just cover the physical and emotional aspect of health. We try and cover other aspects of health, like sexual health that we're going to talk about today. Then there is financial health. Many of people will be so stressed that sometimes that can interfere with one aspect or another, including sexual health and their physical well-being and their emotional well-being. So there are multiple aspects of health that are interconnected that we like to speak about in our office. Today, of course, will be sexual health. What do you think, Dr. Gupta?
Yeah, I think the connection is important, but what's also something that I wanted to mention that you were just touching on is that I was reading that almost what is expected to be a major problem in the United States and across the world with sexual health is that when talking about women and females, up to 40% of the female population will actually bring this up to the physician when it comes to dysfunction with their sexual health.
If it's directly asked for.
Exactly.
Otherwise, they're suffering. 40% of women are actually suffering with some issue or the other, but they wouldn't bring it up by themselves.
Well, is that a certain age? Because you bring up a very important subject here and a very good point, especially women having to bring up sexual, issues, desires, et cetera, to their doctor. Because you would think with the women having over all the years, not only giving birth, but also seeing the gynecologist or obstetrician over the years, you think it wouldn't be an issue as much as it would be for men.
But I think it's also twofold as well. It's not just on the patient. A lot of the times the topic of sexual health is sometimes overlooked by physicians as well. It's an uncomfortable topic to begin with. A lot of the times it's more private than somebody might think. Their blood pressure is not really a private topic or some other aspect of their health. But when we go through a standardized discussion with the patient, there's many sections of the history that we ask about a patient. And generally speaking, when you talk about sexual health, the most reasonable thing would be, how many times have you had a pregnancy, or did you have a cesarean section or a hysterectomy or some sort of surgery? But we often forget to mention, how is your sexual function? Are you sexually active? Is something happening in the bedroom that is making you feel concerned about your health and your well-being? So I think that it's something that not just for women is also something that also equally affects men. And if it happens to be a man and a woman in the same household with both problems that they're not even talking to each other about, they may think that they're the issue, making the problem worse.
Is it more post-menstrual or premenstrual, do you think, that these issues arise?
So menopause definitely is a life-changing event. You know, as the estrogen level, the hormone, female hormone level goes down, the desire will go down, the physical health of the private area will go down. It might become more painful, less moist, less lubricated, and sexual activity might start to be painful. And once that is faced, the male partner, out of consideration, may not even want to proceed further. And the female might feel stumped that what do I do now? Hopefully the female partner then in that situation is happy enough or comfortable enough to go to the physician and talk about it. Because there was a time when these treatments were very expensive, but no longer. These are very affordable treatments, and still some pharmacies, you know, from one pharmacy to another, you could have a tenfold increase in price. Something that'll cost you $25 in one could cost you $300 in another. So obviously you have to watch out, and we as physicians have a role to guide our patients in that moment. But menopause definitely is a life-changing event.
Okay, so some of the questions you'd like to hear in your office is, why do I not enjoy sex, or why is there no desire, or why does sex hurt?
So I think it's important when we talk to a patient and get them to feel comfortable about talking about their sexual health with us, is to let them know that, first of all, everything they tell us is completely confidential. It's kept protected by the law with the HIPAA policy, and something to help, you know, maybe ease the discomfort about talking about the topic is to let them know that there's nothing that's going to leave the room. And what we need to actually address is the different aspects of sexual health that are important to get the proper benefit that we want from a patient to get. So when it comes to the desire and arousal, that's part of the sexual response, is what we call it. For the complete and full response, there's different aspects. And desire and arousal come from a multitude of reasons, which most commonly generally comes from the psychological. Is it something to do with your partner? Is it something to do with the stress? Is it something to do about the interconnected aspects of your life that Dr. Malhotra was mentioning, like your financial well-being, your spiritual well-being, your physical well-being? So if all of these things aren't also addressed at the same time, like with all of the other topics that we've talked about and are going to talk about, then these other things that are more subtle about arousal and desire can become affected. And you know, Dr. Malhotra was just mentioning to me before we started the show that these are things that we can address with all of our patients in secrecy and privacy, but also let them know that they're not alone and that a lot of other patients are going through the same thing, and make them feel more comfortable about talking about it.
So let's talk about some of those problems, like, say, medication, hernia, premature ejaculation, smoking. Let's talk about some of those issues.
Smoking, of course, you know, it is one of the very, very important aspects of health overall. It's not just in sexual health, but cardiovascular health, your lung health, the emotions that you go through, the skin health. As you see that smokers will have these fine wrinkles come on. So there is a multitude of things that happens with smoking. It is for every 10 days that a person smokes for, their life gets cut short by 3 days.
Wow.
So when you start thinking of the impact of smoking, it is widespread. And sexuality and the ability to perform, ability to lubricate your areas, it all gets impacted by smoking. So if you involve a physician to help you quit smoking, your chances could go up 400 to 500% compared to you trying yourself. And every smoker at some point in their lives think that maybe I should quit it, but they don't know how to do it. So I think it's very important that it be talked about, and not just, I mean, sexuality is one of the aspects where it will come up, but in general, it is one of the very important questions that we address, and not just say, okay, you smoke, you should stop smoking. No, but taking it to the next step is where we would be instrumental. As far as the medications are concerned, there are many medicines that can alter the way sexuality happens or behaves. Dr. Gupta, would you like to would you elaborate on some of them?
Sure. So One of the most well-known medications that can affect the sexual health, especially with decreasing a patient's libido, are antidepressants. Unfortunately, they work great in some aspects, but they can have side effects that affect other parts of your life, including, your sexual function. So sometimes what we can do is determine if a patient is eligible to make a switch to a antidepressant form of depression treatment, like with a newer type of medication.
So bupropion, for instance.
Exactly,
Which is
help.
non-SSRI.
Exactly. That can also help with smoking cessation. In fact, it's actually FDA approved to help a patient stop smoking. Can help treat depression and at the same time not affect a person's libido. The other aspects of sexual arousal, erection for a male, are things that can deal with a person's automatic nervous system. And that automatic nervous system plays an important role with a patient to be able to do things such as urination, defecation, sweating. All of these things with fight and flight hormones and rest and digest hormones play an important part with sexual health as well. And common medicines such as older blood pressure medications, some medicines for big prostate as well, those can affect the actual arousal itself and the ability to obtain an erection or feel that you're able to get as erect as you were able to in the past.
And now that we have medicines that can be used for enlarged prostate that actually help with erection, it is such an easy switch for us. Say, hey, and these medicines are affordable. There was a time when Cialis was totally unaffordable. But now that it's used both for the prostate enlargement as well as erectile dysfunction, immediately we make a switch for the patient when we discuss a topic like this and there is an issue.
And I understand that Viagra is still on the market as well, is probably the longest medication that's been available for this situation. There's also some good benefits to it as well, right? I mean, other than just the erection part of it.
Yes,
absolutely.
So Viagra is actually, it's also generic now. Sildenafil is the name for it. And actually was originally made for lung issues and the pressures that are involved in the lung, but was found to have also the effect of causing an erection, which is why it's FDA approved for males. The thing with sildenafil or Viagra when comparing it to Cialis is that Cialis is actually a newer medicine. It's also available generic, and you don't need to sort of interrupt the mood with sexual health to take the medicine in order to get the erection. Because with tadalafil or Cialis is a medicine that you can take either once a day or once every 3 days, and at any time you're ready to perform your sexual health, you can actually not need to stop and take a break in order to get the medication. So it's always in the system. So it's a newer medicine. They're available. They're actually much more affordable than they've been in the past, and we even offer them in our own pharmacy that we have at our office at even cheaper than local pharmacies do. So it's something to ask about. It's something to bring up as a topic and see if that medication is right for you.
Right. Speaking of medications for males, especially after the age of 40, your testosterone starts to decrease dramatically as you age. And there's testosterone supplements out there. Tell us a little bit about those.
Now, testosterone levels are low in some people who do not have any problems, and then there are normal in people who have problems. In our office, we routinely screen everybody above the age of 40 for testosterone as well. Because if we did not, nearly half of the people who are actually having problems with testosterone would not be caught or treated.
Yeah.
So it has now become a routine screening test in our practice. Lower levels of testosterone definitely contribute to decreased libido, to decreased performance, decreased muscle strength, decreased bone density, a less sharp mind, and a more depressed mood. So I think all this is very important to treat. But as you treat, the first principle is do no harm. So we have to screen those patients and monitor those patients as they get treated. Over-the-counter supplements might be available, but they have no evidence that they actually treat the problem. So I would encourage people not to just go and buy something, but talk to a physician. It should be part of your routine care as you discuss your blood pressure or diabetes or your annual physical or just a regular health check, whether you go for a DOT or something, just bring it up and get some good advice on it. It can be used injectable, it can be used as a cream, but whenever it's used as a pill, it is typically not effective. So what people are buying over the counter are things that are pills, and those are not going to benefit you. Plus, the side effects of testosterone have to be monitored closely. So we'd like to see how it's affecting the liver, because it can affect the liver to the point where you can go into liver failure, needing a transplant.
Wow.
So it's very important that we keep a steady check on what's happening there. It can affect the way your prostate behaves and worsen a cancer that might be there. It can affect how your blood is working. Your blood might become so thick with the use of testosterone that is unregulated that you might get a stroke with it. So it's very important from my perspective, that a patient does not go ahead and just buy these supplements, but actually talks to a seasoned physician about something like this.
And the other thing I wanted to mention is that we treat testosterone deficiency. So there's no clear evidence that there's a benefit of testosterone replacement therapy for men if their testosterone levels are already considered normal and they're still having sexual dysfunction. So if that were the case, that's really where you end up in these areas where it becomes dangerous to take a medication if you already have what's considered normal. If you're replacing what's deficient, it's much safer, and it can be done with a much more ease of mind for both the patient and the physician that's taking care of the patient. So we need to make sure that it's not just something we're giving to a person, that we're evaluating every single patient that we see, and make sure that the treatment option for them is the right one and the safest one for them.
And it's as simple as routine blood tests.
Exactly.
Just that simple. Okay, good. That's why we're talking to the doctors, the good docs. It is the Healing Docs show, brought to you by Absolute Healthcare, medical chiropractic services, 3 locations to serve you. They're here on this station every Sunday at this time. Listen into the important issues that matter most to you from Absolute Healthcare. And Dr. Gupta in our studio once again with us this Sunday, and we're talking about overall sexual health. So as far as tests, to begin a test, what kind of test do I need? And I know for men, the testosterone test, to check that, and your prostate, but what else for men and women?
See, the routine screening tests that we perform are your complete blood count, your complete metabolic panel, the testosterone test, and the thyroid. This pretty much encompasses everything that we would need in a usual case. Then there are some unusual cases. We might want to check prolactin levels. In females postmenopausal, we know that the estrogen is going to be low, so we don't really need to test it. Then sometimes in the female with a lack of desire, even the testosterone is low, and a supplementation of testosterone might help them. So we might check their testosterone level. In some males with erectile dysfunction, we might want to get a Doppler ultrasound of the blood vessels of the penis. We might want to get an ultrasound of the other arteries of the body. We might want to get a stress test done. So there are multiple aspects in which each individual has to be approached. And there are many people, males, who will have erectile dysfunction where we don't need a stress test simply because they are exercising well enough by themselves that they've already performed what would be considered a natural stress test. So depending on who you are, whether you're a smoker, what kind of risk factors you have, what your family history is, how your erectile dysfunction started, how your female sexual dysfunction started, we might muster up a list of tests that are appropriate for you.
When is the time for someone to ask themselves, is it time to see a doctor? When is that time when they come across something like this? When they're not performing in the bedroom on a regular basis? I know as you get older, your desire, of course, drops a bit. But when is the time when we ask ourselves, when is it time to go see a doctor?
Whenever you see Absolute Healthcare out there.
Yes.
Yeah, there you go.
Of course. No, so that's a good point, because sometimes, just like with the other topics that we've already mentioned, you try and do things on your own. And if it gets to the point where this is something that's not just affecting you every once in a while, and it's something that's constantly happening to you and starting to affect other aspects of your life, how you feel about yourself, your overall well-being, your optimism about certain things. If your general life is being affected by your sexual health or dysfunction of that sexual health, then that's the time to come and see us. And again, it's an uneasy topic to bring up, and this is why we wanted to take it out to the rest of the world and the community, to let them know that these are things that we think about as well. It's something that if I were to bring it up to someone about myself, I may even feel embarrassed. It's not something, we're all human. So making sure that the patient knows that we're all in this together, we're all part of their care, we all care about each other, can make someone feel comfortable about bringing up things that they may not have mentioned. So any time is the right time to bring it up, even if it's doing great and doing well, letting us know that you're already, checked off in the box of sexual health or spiritual health or financial health, so that we can start focusing on other things, even if everything is doing well.
Mm-hmm. And it all starts at Absolute Healthcare, medical chiropractic services, Spring Hill, Port Richey, and of course Tampa. Give them a call, make your appointment now. So after we see Absolute Healthcare, you may recommend us to a specialist. Is that right?
In some cases.
Okay.
Most of it, I think 95% of the problems will get sorted out right at the office.
Right.
And then there are some situations where we want a specific test done that we want performed, or a specific intervention done which is invasive that we may not be doing.
Okay.
But by and large, I think everything gets taken care of between our offices, and fairly well with cutting edge technology.
Mm-hmm.
So, and as far as seeing a physician was concerned, I think it's not only when you have a problem, but even below the age of 40, see a physician at least once every 2 years. Thereafter, at least once every year.
Okay, and to prepare ourselves, we may start to make a list of questions ahead of time, which is, I think, an idea, a way to go is make sure you have those questions available for when you go see your doctor. What are some of the questions that we may expect from the doctor?
Yeah, so I think that when it comes to what we may ask a patient, again, it's going to be talking about all aspects of a patient's health. But specifically with regards to their sexual health, we may ask, how long has this issue been going on? Mm-hmm. What part of the sexual function is actually dysfunctional to begin with? Did you have a prior traumatic incident that was either emotionally affecting you or physically affecting you that needs to be addressed and also discussed about? Do you use drugs or alcohol? Do you have an affliction to something that can easily be addressed and focused on first? And those are the things such as do you have issues with the partner that you're having the sexual function with? Is it something that's going on in your relationship where you feel that you can't talk to each other, where you can't bring up certain things about your health that you're either embarrassed to talk about, or have the fear that they may not, care about you in the same way anymore that they may have used to? So a lot of these things are going to come down to what's surrounding the issue. And then, yes, there are true dysfunctional, what we call organic, there's something physically wrong with the organ itself that we can address, but we like to look at the surrounding environment as well and make sure that there isn't anything there that can, worsen the actual sexual health of a patient. Correct.
What options they've already tried. Because many people have done a bunch of self-help before they actually will approach a physician.
Right.
It's, for instance, if we were talking just about erectile dysfunction, we would talk about whether can you initiate it, can you maintain it, is your nighttime erection okay or not, do you wake up with an erection or not, which is what should be normal. So these kinds of things, and how we can evaluate those aspects. In the female, about the moisture, about the pain, when you're performing, about incontinence, which can sometimes be affecting how you perceive yourself. Your own body self-image might be affecting it. If you need to lose weight and that'll make you feel better, how can we achieve that? So is your blood pressure medicine interfering with stuff? So did this start immediately after some medicine was started? So these kinds of things are what we are interested in to see what is the accurate thing to do for each patient.
And I'm sure that anxiety, depression, and stress all adds to this. What about post-surgery? Like, say we've had surgery on our back or leg or hip or whatever the case might be. Would that cause problems like issues like this too, sexually?
Sure. I think that the question should be, is it limiting you in terms of your physical ability to do any movement at all? Or did the surgery itself affect some of the nerves that are actually acting on, your sexual organs? So because the spine is not just a big bone in the back of our body, it also has all of the nerves that send all of the signals to the rest of our body. So determining what if both or just one of those is affecting you is the first thing to address. And secondly, if for some reason that was the issue, then we need to focus on a different aspect of your life first. We need to get you more mobile, more active. At our facilities, we have physical therapists, we have equipment in the gym.
We have a gym
Yeah.
with a personal trainer,
Mhm.
so that we don't just send a patient out and say, do this.
Right.
We say, no, let's help you establish immediately so that we can start changing today.
It starts right there with the good docs at Absolute Healthcare. So we have a few minutes left, doctors. In the meantime, you've mentioned the nervous system, you've mentioned the psychological, physiological. What about mental?
Yeah, so I think mental health is probably one of the largest, if not the biggest aspect of a patient's sexual health. Yes, there's always going to be true medical diseases that we need to look for and discuss and treat if possible.
The physical ones.
Exactly. And if the mental diseases that are affecting you in the greatest part of your sexual health, then we can address those without having the side effects of sexual dysfunction or decrease of libido, which a lot of the depression or stress and anxiety medications could cause, especially the older ones. So looking at that from an overall aspect is going to be the biggest contributor. And sometimes, even if a patient is on these medications and we can't remove them, we're always looking for the most cutting edge technology that may not be an invasive or surgery or a pill. In fact, we've been in discussion, and now we've just received the first unit. Is that correct, Dr. Malhotra?
That's correct.
Of a new device that doesn't have any surgery or surgical incisions or needles or anything like that. It's a new device. It's still being tested, but we offer it to our patients because it still has a safe profile and can be tried. So it's nothing that we talk about now is still set in stone, which is why we can offer patients, prospects for the future if everything they've tried so far has failed, and different things that we can offer a patient in terms of, these new machines that are coming out to see if that may benefit them.
And that should be your next move, is to see if that is one of the things you need to seek at Absolute Healthcare. Just make an appointment today, and that's why the good doctors are here on the Healing Docs Show, brought to you by Absolute Healthcare, to bring all this important information to you. Just 2 minutes left. Gentlemen, what do you want to wrap up with?
I think it's a message not just to the patients to be able to bring up the topic, but even to other physicians who might be listening, that you must become well versed with the treatment of sexual dysfunction, so that you yourself are comfortable talking about it and bringing it up with the patient. So it is a mutual lesson to both physicians as well as patients to say, please bring up any difficulty, any aspect of your life, because we are here to compassionately be there and help you out. We ourselves have been in certain situations where we feel embarrassed, as we were talking about, to talk to a physician. But who else should we talk to? It is the best spot to bring up your difficulties.
Your doctor is also human too. And I also understand you make presentations, you do presentations in the community, is that right?
Yes, so if there are communities, particularly senior communities, where I go to and talk to them about common topics that might be affecting them, like balance, like blood pressure, diabetes, weight loss, joint problems. So yes, it's such a pleasure to go there and mix with these seniors and have a good time. Sometimes I get invited to play pickleball or something else with them, and they beat me.
Yeah. Oh, yeah.
Some of them are so good at it, and I enjoy the interaction.
There you go. And I'm sure we'll keep our listeners tuned into that if anything comes up when the doctors are out and about in the community. In the meantime, make your appointment with Absolute Healthcare LLC, Medical Chiropractic Services. Give that Spring Hill office a call. There's an office in Port Richey as well, and of course Tampa. The phone number is 352-796-7171. You can book your appointment online, actually, at absolutehealthcare.org. And as far as the docs are concerned, they want you healthy, and they're going to make sure it happens at Absolute Healthcare. So, gentlemen, we do appreciate your time. We'll see you next Sunday at 9 a.m.
Thank you.
God
Thank
bless.
you very much.
All right.
Good job.
That's good.
So good.
Oh, you're so good. That's good.